So you have sensitivity of your penis, and you have pain in the shaft or the tip of the penis or in your testicles. And they've done the STD testing and they've done the UTI testing. Everything's coming out clear, and they still have put you on antibiotics, and you feel better, but then as soon as the antibiotics over, you still continue having these issues. If that's your case, this video is for you. From my perspective, and I'm a clinical rehab working on stability of the pelvis. So I work on pelvic floor dysfunction, which this falls in that category, even though I'm not dealing with the penis itself. It's the symptoms that you come up with that tells me a lot about what else is happening. So let me clarify something here. There are muscles that are inside your pelvis, and there are, of course, muscles that are outside your pelvis. And you've got your lower back muscles because they're supporting your spine in the lower back area, and then of course you've got your hips where your lower extremities go to. So any instability in these will cause instability of your pelvis. Instability of your pelvis is how things show up with different symptoms, sensitivity in your penis, or sometimes they describe it as feeling itchiness in the pelvis or in the penis. Is one of those things. So pelvic floor dysfunction has many faces. This is one version of it. So let's explain what happens. You have these nerves that exist in the lower pelvis, in the sacral area, that they come out right here. You can see the yellow. They come out, they go weave in and out of your pelvis. And there are things that there are muscles that they are sitting next to, or they're going through areas where other muscles exist. So you can have mechanical compression of these nerves, and these nerves ultimately go and branch off superficially. They cause a sensation, or they're in charge of sensory or sensation in the penis or vulva, in the perineum, and around the anus. Motor part of the same nerve causes the sphincters to, basically it's in charge of the sphincters. So as I mentioned to you, as these muscles, as this nerve weaves in and out of the pelvis, any kind of muscles, any kind of tightness within the joints can irritate these nerves, and you can end up with those sensitivities. So that's the reason why your STDs, your tests are basically negative. They look x-rays, they do blocks, they do this and that, but the reality is, as long as those muscles are tight, you're gonna have these issues. So then what's the treatment? In the world of pelvic floor, majority, and when I say majority, I'm talking about 99%, probably, let's just say 95% of times, what is being done is we go through the anus to access the muscles on the inside. But let's be real, how far do you think that index finger is gonna go? Because the very nerve that I'm talking about sits right next to piriformis as one of the muscles, and I promise you, no finger is gonna get from inside to the piriformis area to try to relax that muscle. And if you're thinking, well, I can stretch my piriformis muscle to relax those, think again, because you are not thinking about what caused that piriformis muscle to get tight to begin with. So what's the solution? The solution is to stabilize the pelvis, which is the house that pelvic floor is the floor of. So I know this is not the answer you want, but I'm not giving you the answer you want. I'm giving you the right answer to the solution. So what do we need to do? We need to stabilize the pelvis, which means the spine connection to the pelvis, the lower extremity connection to the pelvis, the different bones that the pelvis is made out of, and basically the long way, but the right way to fix this issue. If this makes sense, comment in wherever you can, and ask your questions. Contact my office If you can relate to this, let's figure out what is happening. Don't get sucked into what's out there and what everyone else is doing, because if it was working, people would be having the solution long term. This approach is from functional mobility perspective, is from biomechanical perspective, and that's exactly the kind of work that I do. Thank you for watching.